What is blood pressure? Blood pressure is the force exerted by the circulating blood on the walls of the blood vessels and constitutes one of the principal vital signs. The blood pressure is generated by the heart pumping the blood into the arteries and is regulated by the response by the arteries to the flow of blood. When the flow of blood is too low to deliver enough oxygen and nutrients to vital organs such as the brain, the heart and the kidneys, the organs do not function normally and may be permanently damaged. What is the healthy blood pressure? When heart beats, it pushes the blood through the arteries in the body. The systolic blood pressure measures pressure generated within the arteries when the heart pumps. The diastolic blood pressure measures underlying resting pressure within the artery when the heart is collecting blood and not pumping. Any blood pressure reading above 120 by 80 mm of mercury is considered abnormal. During relaxation of the heart, that is diastole, the left ventricle of the heart fills with blood returning from the lungs. The left ventricle then contracts and pumps the blood into the arteries. This phase is called systole. The pulse that we can feel when we place our fingers over an artery is caused by the contraction of the left ventricle. How is blood pressure determined? The blood pressure is determined by the amount of blood pumped by the left ventricle of the heart into the arteries and resistance to the flow of blood caused by the walls of the arteries. Generally, blood pressure tends to be higher if more blood is pumped or if arteries are narrow and stiff. Blood pressure tends to be lower if less blood is being pumped or if space within the arteries of the body is larger and have less resistance to the flow of blood. How does the body maintain normal blood pressure? The body has mechanisms to alter or maintain blood pressure by specialized nerve cells called baroreceptors. Baroreceptors are spray-type nerve endings in the walls of the blood vessels and the heart that are stimulated by absolute level of and changes in arterial pressure. They are extremely abundant in the wall of the bifurcation of the internal carotid arteries and in the wall of the aortic arch. These sensors sense blood pressure and then send the signals to the heart, the arteries, the veins and the kidneys that cause them to make changes that regulate blood pressure. The goal is to maintain cardiac output, that is, the amount of blood delivered to the organs in the body. Baroreceptor signals to the heart can speed up the rate and force of contraction of the heart to eject more blood per minute. This response increases the flow of the blood into the arteries and may increase blood pressure. Baroreceptors can signal veins to expand so more blood can be stored in the veins and less blood returns to the heart for pumping into the arteries. As a result, the heart pumps less blood per beat and the blood pressure may decrease. On the other hand, when veins narrow, less blood is stored in the veins and more blood returns to the heart for pumping into the arteries and the blood pressure increases. Signals to the arteries. When blood pressure is high, receptors signal to the arteries to expand, creating less resistance to the flow of blood and decrease blood pressure. When pressure is low, narrowed arteries create more resistance and raise blood pressure. Signals to the kidney can respond to changes in blood pressure by increasing or decreasing the amount of urine that is produced. Urine is primarily water that is removed from the blood. When the kidney makes more urine, the amount of blood that fills the arteries and veins decreases, and this decreases the blood pressure. If the kidneys make less urine, the amount of blood that fills arteries and veins increases, and this increases blood pressure. Compared with other mechanisms for adjusting blood pressure, changes in the production of urine affect blood pressure slowly over hours and days. The other mechanisms are effective in just seconds. Is low blood pressure bad for your health? People who have lower blood pressures have a lower risk of the stroke, the kidney disease, and the heart disease. The athletes, the people who exercise regularly, the people who maintain ideal body weight, and non-smokers tend to have lower blood pressures. Therefore, low blood pressure is desirable as long as it is not low enough to cause symptoms and potentially damage organs of the body. What are low blood pressure signs and symptoms? If low blood pressure is the normal state for a patient, then there will be no symptoms. However, if low blood pressure is symptomatic, then patient may feel lightheaded and dizzy, unsteadiness as blood flow to the brain is reduced. There may be blurring of vision, weakness, confusion, and nausea. Other organs may be involved, causing chest pain, shortness of breath, cool, clammy skin, and passing out or fainting. What are the causes of low blood pressure? Conditions that reduce the volume of blood, for example, bleeding and dehydration. The conditions that reduce cardiac output, for example, heart attack and cardiomyopathy. And conditions that reduce the tension in the artery walls may cause low blood pressure. Medication side effects can cause low blood pressure, as can spinal cord injuries. Neurological causes of low blood pressure. The body requires the central nervous system to be functioning normally to maintain a normal blood pressure. There is a balance between adrenaline system and vagus nerve. If there is overstimulation of the vagus nerve, the veins will dilate, not enough blood will return to the heart, and blood pressure may fall. Neurological causes of low blood pressure. Vasovagal syncope is very common and often occurs when a noxious stimulus occurs, such as fainting, which occurs at the site of blood or with pain. Sometimes the vagus nerve is stimulated when a person pushes too hard when urinating or having a bowel movement. If adrenaline to arteries is blocked, like in a spinal cord injury, the tension in the artery walls is lost and the arteries will dilate, not maintaining blood pressure. Non-neurological causes of low blood pressure. Some non-neurological conditions that can cause low blood pressure include bleeding, dehydration from vomiting and diarrhea, or infections, abnormalities in adrenal gland function, and blood loss. Pregnancy may cause lower blood pressures as part of normal physiology. Can medications cause low blood pressure? Medications may cause low blood pressure. Medicines used to control high blood pressure, such as angiotensin receptor blockers, beta blockers, calcium channel blockers, alpha blockers, diuretics, or also called water pills, can work too well and cause symptomatic low blood pressure. Other medications may cause low blood pressure as a side effect. Examples include tricyclic antidepressants, for example amitriptyline, Parkinson's medications, for example levodopa and carbidopa, and drugs for erectile dysfunction such as sildenafil, all can cause low blood pressure. Alcohol and narcotic pain medications may also cause low blood pressure. What other conditions cause low blood pressure? Septicemia is a severe infection in which bacteria or other infectious organisms such as fungi enter the blood. Commonly, the initial infection may originate in the lungs as pneumonia, or in the urinary bladder as urinary tract infection, or in the abdomen as diverticulitis. If infection is untreated, bacteria enter bloodstream where they may release toxins and cause life-threatening, profound low blood pressure. This condition is called septic shock, often with damage to several organs. A serious allergic reaction to medications such as antibiotics, foods like peanuts, bee or insect stings, or intravenous contrast dye used in medical studies is called anaphylaxis. Allergic reaction causes body's immune system to become out of control. However, this situation is not common. How can you diagnose low blood pressure? Measuring blood pressure in the lying, that is spine position, and standing positions is the first step in diagnosing low blood pressure. In the patients where low blood pressure is causing symptoms, there often is a marked drop in blood pressure upon standing, and patients may even develop lightheadedness and feel as if they are going to pass out. In the low blood pressure, the heart may increase. Once low blood pressure has been established, its etiology or cause needs to be found. Sometimes causes are readily apparent. For example, trauma with bleeding or a spinal cord injury or vasovagal syncope. At other times, cause may require tests to determine the source of the condition. How is low blood pressure treated? The patients with symptoms that are possibly due to low blood pressure should be evaluated by a doctor. Patients who have had a major drop in blood pressure from their usual levels, even without the development of symptoms, also should be evaluated. How is low blood pressure treated? The treatment of the low blood pressure will be based upon the cause of the low blood pressure reading. For example, a person being treated for high blood pressure may need to have his medications reduced or adjusted. Or for a person with dehydration due to vomiting and diarrhea, intravenous fluids may be required.